Well, there's a very big problem in Africa in healthcare delivery, not really with vaccines and certainly not with expertise in healthcare, but in getting to the villages, to the distant places. If you're not reaching people, not reaching children to do immunization, then you can't immunize them. So it's a big problem, and that's what Riders addresses.
In the last 25 years, Riders has developed systems to run and manage vehicles so that they never break down. And in so doing, we're reaching over 25 million people with the healthcare that they so desperately need. If we're going to replicate fleet management for the delivery of healthcare across Africa, we can't do that with old paper-based systems.
Data is important to our work because we're able to measure the impact of the work that we do and also to ensure that it's relevant towards achieving goals for health. You know, it takes a long time to get data from the field to actually the person who's going to enter it into the system. But also it takes a lot of work for that person to enter data. You don't get to analyze the data. We can't make decisions because it's so difficult to get it all into the system so that we can be able to analyze.
We've been collecting data in this conventional way for over 20 years, so going digital would change things, make life better for both the workers and also bring about improved health care for everybody. The challenges we have amongst them are the late entry of the data, because by the time we receive the forms from the regions coming and having them entered, at times it would take a month or more to have the data entered. So we cannot have real-time data which we can rely on for management and predictions of our work.
We're very fortunate at this time to be able to partner with both Dharma and Uptake. Both organisations are focused on data collection that really changes people's lives. We're now building a digital system to collect and analyse all the data across our programmes. Ambulances, motorcycles and other vehicles are being fitted with Uptake's Geotab trackers. They record location, mileage and vehicle efficiency. Outreach doctors and nurses and couriers working with samples for diagnosis can now record what they're doing on a tablet or a phone. And maintenance technicians with the new app can enter the work that they've done and then can look at the vehicle history at a glance. And this is all done with apps built with Dharma technology.
With the new digital system, I don't have to get worried about filling out or delivering paperwork. It gets straight from the app to the office and I can get back to my work.
So you save time, you can do more work in the field, you can have more time with your community, and that really helps a lot. Having your own summary available from the tablet, fantastic, amazing. You can judge your own, you can do your own assessment on your journeys, on your work.
Yeah, we need to go digital because that's what the whole world is doing. We need to really be moving fast and be making decisions quick. It will help us a lot because we'll be able to save a lot of lives, because if we do it later, it might be too late for some people.
And what we've got here is the development of a partnership between Ministries of Health, Dharma, Uptake, Riders for Health. For me, that's very powerful.
If we don't reach people, children, adults, women in threatening labour, everybody, there is a very serious danger that people will die. And now we have something that's going to be available to people across the globe, and it will have a huge impact in that way, much bigger than people realise.